Hello and welcome to this Wellbeing for All podcast titled Health Equity Uncovered, part of BNU's Public Health Engagement Week. I'm Melanie Hayward, Associate Professor of Education here at BNU and a Registered Specialist Community Public Health Nurse. This episode is a subject close to my heart, focusing on health inequalities and their impact on our communities. We'll be diving deep into what health inequalities are, why they matter, and how we can work together to address them. We are absolutely honoured to be joined today by our very special guest, Adetoro, who will share her insights and expertise on this critical issue. Thank you for tuning in, and let's get started. So, first question, Adetoro, can you briefly introduce yourself and explain your role here at BNU?
Thank you so much, Mel. Thanks for having me. And I'm very much looking forward to us discussing the subject that is very close to my heart, which is discussing health inequalities. So my name is Adetoro Adegoke, and I'm a professor specializing in health inequalities at Buckinghamshire New University, where I focus on understanding and addressing the disparities in health outcomes among diverse populations. So my role primarily involves conducting research, collaborating and partnering with various stakeholders within health sector and outside of health as well, to design interventions that bridge or that can bridge the health gaps, particularly in underserved communities.
Brilliant. Thank you. So let's start with just unpicking health inequalities. How do you define health inequalities, Adetoro, and why are they important to address?
Yeah. Thank you so much, Mel, for that important question. Let's start by looking at the definition of health inequalities. So when we say health inequalities, what do we mean? By health inequalities, we're actually referring to the differences in health outcomes across different population groups. These disparities actually often stem from factors that are beyond individuals' control. Such factors include socioeconomic status, where people live, their geographic location, and their ability to access healthcare. It is important that we address health inequalities because everyone actually deserves an equal opportunity, to achieve their best health, regardless of their circumstances or their background. So we really need to address health inequalities.
Absolutely. So when we think about Buckinghamshire, which is obviously where BNU is based, what are some of the most significant health inequalities in this area?
Thank you, Mel. I think the case of Buckinghamshire, like a lot of counties within the south eastern region of England, is a bit peculiar, because if you look at Buckinghamshire as a county, the county has low levels of deprivation, compared to other counties within the country. In fact, according to the English indices of deprivation, it shows that Buckinghamshire actually ranks 7th least deprived out of 151 local authorities. That means that Buckinghamshire is actually an affluent county. But despite the overall affluence in Buckinghamshire, there are stark differences in health outcomes between different communities. For example, if we look at some areas within Buckinghamshire, they tend to have higher level of deprivation. So such areas include Aylesbury, High Wycombe, Chesham, which have actually been classed as being within 20% of the most deprived areas inside Buckinghamshire. So some of the health inequalities within these communities include disparities in mental health access, availability of preventative care, which cuts across not only general physical health, but mental health, and then also preconception and maternity care. So if we delve a bit deeper into women's health, similarly to what we have nationally in Buckinghamshire, the general health and well-being of women living in the most deprived areas, such as these 3 areas that I've mentioned, are actually significantly worse than that of women that live in the most affluent part of the county. So while women who live in the least deprived areas have higher level of access to healthcare, higher level of physical activity, women that live in the most deprived areas tend to have a lot of issues, high prevalence of smoking, issues around depression, higher hospital admission rates, for a range of conditions, including cardiovascular diseases, misuse or the use of alcohol, and deliberate self-harm. So you have a county which is tagged as being affluent, but within it, there are pockets and there are areas of deprivations. So that is the situation of Buckinghamshire.
Okay, really interesting. So if we think about kind of the cause of them and the impact of them, what are kind of the main factors that contribute to health inequalities? I know you sort of started to unpick that, but is there anything else to add to that?
Yeah, thank you. So I started off by talking about the difference in the socioeconomic status, but other key contributors include the educational level, the housing conditions that people live in, the opportunities to jobs, so employment opportunities, and the social support networks that people have. I think looking at each factor individually is difficult enough. But what you often find is that these factors tend to then intersect. And because they intersect, they tend to create a more complex, a lot of complex barriers that not only hinder individuals from accessing quality healthcare, but also impact their ability to make healthy lifestyle choices. I don't know if I should give some examples here. When we talk about, the socioeconomic status, so the social determinants. So let's look at income and education. Income and education will influence people's ability or individuals' ability, to access resources. And because it's hindering people's ability to access resources, it then determines the type of housing that they go into. And when we're talking, and that quickly leads into the environmental factors, like I mentioned. And if people live in maybe that housing condition or neighborhood conditions that are not that good, then this will directly impact, not only their physical health, but their mental health. For example, for people that live in areas, let's say in areas with limited access to fresh food, they then have or may have poorer diets, which tend to contribute to higher rates of obesity and related health conditions. So the intersection of these factors make them much more complex and a lot more difficult, to resolve. And it's very important that when we are addressing health inequalities, we look at all those social determinants and see how they are linked or they interconnect.
Yeah, absolutely. So there's something here about how it affects individuals as well as whole communities as well, isn't there? And whether that's it's a day-to-day thing, but also it's cumulative. So is there anything sort of additional to add to that at all, Adetoro?
Yeah, I think if I give like an example, it was interesting when you mentioned how it affects not only the individual but then the community. An example is the increased prevalence that we've seen in respiratory issues in people that live in communities that are very near, to industrial zones or major highways. Their daily exposure, to pollution tend to exacerbate, conditions like asthma and increase also the incidence of chronic respiratory diseases. Similarly, for people that have limited access, to mental health services in low-income communities, that can lead to higher rates of untreated mental health issues, thus impacting overall quality of life for those individuals and for the communities.
Mm. Okay, so if we sort of think about public health and well-being maybe more broadly, how this is kind of connected, how does improving public health contribute to reducing health inequalities?
Improving public health is very critical to reducing health inequalities because public health initiatives target the root causes of health disparities. It does that by promoting preventive care, by improving access to services, and by fostering, environment where people are able to make healthy choices, and those healthy choices are also accessible to them. So public health initiatives or public health address those foundational or fundamental aspects and can then help, to level the playing field, ensuring that all individuals have a fair shot at a healthy life. Yeah. So.
Okay. And behind a lot of these initiatives is obviously public health policy and strategy and other such things.
Yeah.
Can you give us a bit of information about how that, helps us to address these inequalities, sort of the policy that's behind it?
Yeah. So public policy is very vital because it creates the frameworks that support health equity. When we have effective policies, then those policies would or can promote, affordable health care, can target people that live in underserved areas, ensuring that they have enhanced access not only to health, but education, to job opportunities, all those social determinants that we described earlier, improve housing, environmental conditions. Public policies create the infrastructure that is needed, to support long-term health equity. So they are very, very critical to addressing health inequalities.
Okay. And what's the kind of relation between when we talk about public health and well-being?
I think sometimes people tend to, I wouldn't say make the mistake, but people tend to look at public health as being just about preventing illnesses. But no, public health is not just about preventing illnesses. It's also about enhancing, quality of life. So a good public health measure will promote that sense of well-being, will reduce stress and issues associated with health concerns, and will enable people to participate fully in the society. So when we address health needs at community level, which is what public health is, we foster resilience, we empower, and we also create that well-being across the entire population.
Yeah, absolutely. So thinking about population, improving well-being, improving people's health, and obviously some of our listeners will be really interested in what we doing in BNU then, because BNU is its own community. So what initiatives are you aware of that are currently in place at BNU to address health inequalities?
Yeah, so at BNU, we have several initiatives, and such include community health outreach programs, We collaborate with local health authorities. We collaborate with voluntary community social enterprise, civic society. As a university, like you know, we also have educational programs that are aimed at training future healthcare professionals to be very sensitive, to the issues of health equity, and to understand, the unique needs of underserved populations. So we not only support through education of future healthcare professionals, but we also have specific projects, programs, and initiatives wherein we work in collaboration with the community members themselves, and then the assets within the community, the partners, the networks between the community, within the communities. Yeah.
So can you highlight any of those specific kind of programs, initiatives? Is there any case studies or anything you'd like to share that that have had significant impact here at BNU and wider?
Yeah. So let me describe one. So one of such impactful program has been our collaboration with the local mosque in Wickham to improve health literacy, health awareness, promote access to screening, and not only screening, but signposting services, among the people within the community. So working with the healthcare trust and working with other service providers. So we take services, to the communities. So by using the mosque or by using that venue where people feel, where people are more familiar with, so it helps to ensure that feeling of being comfortable. People felt much more safe and much more in control because it's the environment that they are used to and they are familiar with. But then also importantly, it starts to take away the gap or that bridge, or remove the bridge between the community and the health service. So the health service is being brought to the community. So with that, trying to bridge that mistrust, trying to build trust, within the community. So that was a very successful collaboration that we had, with the community, and it was really, really lovely to see people coming around, people discussing, and then people being able to access services, within their own safe space or environment. Yeah.
Brilliant. Sounds really great.
Yeah.
So what role can students and staff at BNU play in promoting health equity?
I will encourage students and staff to engage with local communities. We have, as BNU students, as BNU staff, we have that incredible opportunity because we are within the community. We should engage with our local communities, and then also for staff and students to participate in research and to volunteer in public health initiatives. This will not only enrich the learnings that people will have, both students and staff, but it will also contribute to the collective efforts that we are all doing, to reduce health inequalities by providing, that hands-on support where it's most needed. Yeah.
Great, thank you.
Mm-hmm.
So if we think about the future, Adetoro, what are some of the kind of emerging trends or kind of research areas in the field of health inequalities?
Should I say exciting times?
Yes, absolutely.
I think most times when we say, okay, emerging trends or exciting times, a lot of the time we are looking at data analytics, we're looking at artificial intelligence. So I will talk about that briefly. but also importantly, emerging trends are focused on community-based approaches, interdisciplinary working, and focusing much more on the broader social determinants. So let's quickly talk about AI. So now researchers are using big data and AI, to analyze health outcomes across demographics in a much more precise way. And with that, patterns that would have otherwise gone maybe like unnoticed are being picked out. Issues around ethnicity is being brought out. But then much more importantly is the ability to actually predict what is implemented, predictive type of analytics, which will help to anticipate or identify areas where interventions, are mostly needed. Earlier on when we talked about policy, so this is very important to, policy making as well, because it allows, resources to then be allocated much more efficiently to those areas where they are needed. The other emerging theme is the issue of focusing on the community. So a lot of focus on community-based participatory approaches, research, by ensuring the engagement of communities in research is now seen as being very, very crucial. So before people look at it as a nice to have, just say, oh, we included the community, but now the focus is for communities to drive, the research agenda themselves, to also lead the implementation or the design of interventions, for their communities. This approach not only help to build trust, but then it means that when solutions are designed, it means that the needs of the communities are better identified. And with that, we can have much more tailored, effective interventions. But the other thing is that when we have those solutions or interventions, then whatever we're able to achieve will be much more locally supported and will be much more sustainable. So there's that focus on community-based participatory approach. I talked about, or we were talking about the social determinants earlier on. So there's that broader look on social determinants of health, but in a way to support a multidisciplinary or interdisciplinary type of research. So when we're talking about the contributory factors to health inequalities, we talked about a lot of factors that are not directly within the health sector. Like housing is not within the health sector, education is not within the health sector. So we need to, when we're trying to understand what these barriers are, when we're trying to understand what the issues are, then we need to work across disciplines. We need to be able to come together to have a better understanding, of the issues that we are looking at. But then also develop or be able to work multisectorally, to identify interventions. So for us to be able to develop effective intervention that will have impact on health, when they are related to housing, we cannot limit it to the Ministry of Health. So it will include the Ministry of Housing and local government and communities. You get what I'm trying to explain? So there's that need to be that joint up thinking and approach rather than, silo working or individualized type of approach. So a lot of the issues related to health inequalities are not in health. So we need to be able to work together in collaboration, in partnership with the communities, with the community members themselves, to be able to address health inequalities.
Yeah, absolutely. That makes perfect sense. And I mean, in England, public health actually sits in a local authority, doesn't it? That's the leaders in public health, not in by the Department of Health. So yeah, this is really important, as you say, that we have to walk across all organisations, all departments, all services, etc. Is there the AI bit? That was really, it's all fascinating, but the AI bit was really interesting. Is there any other kind of technology or innovations in that area, or that are helping reduce health inequalities that you can add?
Yeah, there are work ongoing on wearable technology to improve access of women, especially those from Black and Asian minority ethnic background, to accessing maternity services. So it provides not only information about their health, but then provide also prompts about when they need to seek help or access services. There are also a lot of development in remote monitoring, which are particularly beneficial to people that live in rural or underserved areas. So some form of tracking and support, for people that live outside or in areas where they are underserved.
Okay, really interesting. Right, we're going to have to start thinking about ending our podcast. So just some closing thoughts from you, if I may, Adetoro. What message would you like to leave with our listeners about the importance of addressing health inequalities?
Yeah, thank you so much, Mel. So let me say that addressing health inequalities is not only a moral imperative, but it's also essential if we want to have a thriving society. Because when we reduce health disparities or inequalities, we are creating a healthier, more empowered, more resilient population or community where everyone has, the opportunity to reach their full potential. So it is very, very important for us to address health inequalities.
Great. And how can the wider community get involved in supporting these public health initiatives?
Community members are the bedrock of health within the community. And I like, the example you gave when you were talking about the health being situated within local authority. So community members can support public health by participating in local health programs. They should also advocate for policies that promote health equity. Be familiar with such policies and be able to add their voice, to the effective implementation of our policies. Also importantly is for community members to be informed, to stay informed about the health challenges within their neighborhood or their neighbors face. I think earlier on I talked about the importance of collective action. So collective action and awareness are key. They are very, very critical to making meaningful progress, in reducing health inequalities. So we all need, to come together, the community championing, their health. So that's very important.
Thank you. There's so much more we could discuss, Adetoro. There's so much more you could share, I know, but I'm afraid we've run out of time for today. So thank you to all of our listeners for listening and joining us on this great episode of the Wellbeing for All podcast, Health Equity Uncovered. We've explored the complexities of health inequalities, their causes, and the profound impact that they have on individuals and communities. Adetoro has provided us with valuable perspectives on public health initiatives and what's making a difference. Remember, everyone, addressing health inequalities is a collective effort. Adetoro has made that really clear for us today, and we've all got a role to play. So stay informed, get involved, let's work together to create a healthier, more equitable future for all. Thank you. Thank you, Adetoro.
Thank you so much, Mel. Thank you. Thank you so much, everyone.
Bye-bye.
Bye.